From the television studios of the House of Representatives, this is Ask Congress. This is Congressman William Roy, Democrat of Kansas, serving his first term in the House of Representatives. Congressman Roy is not only one of the few medical doctors in the Congress, he's also an attorney. Congressman Roy is a member of the Committee on Interstate and Foreign Commerce. And this is Congressman Tim Lee Carter, a Republican from Kentucky, now serving his fourth term in the House of Representatives. Congressman Carter, like Congressman Roy, is a medical doctor and a member of the Committee on Interstate and Foreign Commerce. Both Congressman Roy and Congressman Carter are members of the Subcommittee on Public Health. And I'm Congressman Lester Wolff of New York. Our show, Ask Congress, is brought to you each week in the hope that by addressing our viewers' questions to leading members of the House of Representatives, that we can bring Congress closer to the people. Our questions are based upon those sent in by our viewing audience, and if you have a question that you would like answered on Ask Congress, please send it to room 471, House of Representatives, Washington, D.C. Today we're going to depart slightly from our regular format. We have asked Congressman Roy and Congressman Carter, both of whom are medical doctors, as you've heard, to join us in a discussion of the several important national questions regarding health care in the United States. We've received numerous inquiries on this subject from many of our viewers, and we will address our first question to Congressman Roy in just a moment. Congressman Roy, our first question today is from Harriet Fain of Laurel, Maryland. She asks, we hear a great deal these days about different proposals for national health insurance. Can someone tell us what are the differences between the programs and what Congress is doing about them?
Well, first of all, there are four basic programs. There's the program of the administration, President Nixon's program. There's a program of health security as offered by the Committee of 100 and Senator Kennedy and Representative Griffiths. And then there are programs offered by the health insurance industry and by the AMA. And of course these are various schemes or various ways whereby people would have their health insurance paid for and with the assurance that everyone had health insurance. The President's program focuses primarily on family health insurance program, which is a method whereby the employer and the employee would have money deducted from regular wages.
Similar to Social Security?
No, I don't. I don't believe this is administered through the Social Security Administration, if I'm not incorrect. But it goes in this direction. And then, of course, the Kennedy program does use Social Security funds plus general funds plus a contribution by the self-employed, and is made up of those three elements. The American Medical Association plan goes basically to tax credit. It's called Medicredit. And in this sense, the money which would be necessary to finance the insurance program is deducted, the insurance premium paid is deducted from the income tax that one would ordinarily pay. And then there are, of course, in all of these programs, provisions for those who are unable to pay. So basically, somebody's going to have to pay for it. And there's a good question as to what is the best way. Now, what's being done about it is the second half of the question. And it appears that the Ways and Means Committee in October will have hearings on the various health insurance schemes. This goes first to the Ways and Means Committee because of the tax elements in these programs.
Carter?
Well, there are many aspects to the different bills that have been offered. One of the plans which has been offered is, of course, that of the insurance companies, which really is very good. Up until a certain point, the insurance would be subsidized by the federal government. After that, people would pay according to their income on their health plans. And many of these plans, all of them really are good and have advantages. Some of them are more expensive than others. The fact about the matter is we're going to get what we pay for.
Which plan do you favor, sir?
At the present time, I favor the administration plan. We might go into that just a little deeper and say that, to begin with, 65% of the cost is paid by the employer for the first 2 years, 35% by the employee, and after that 75% by the employer and the balance by the employee. There are many new concepts in this plan as there are in the others. One is a health maintenance organization, and the emphasis is to be on keeping people well, to pay physicians to keep them well rather than treating them after they get sick.
Well, aren't we going to have the same sort of problems that we do have today? And the fact that the doctors are really so overworked with Medicare and Medicaid in most areas of the country that they won't be able to handle the traffic that they get?
Well, our present health manpower bill, which is in conference now between the House and the Senate, and I happen to be a conferee, attacks this problem. In this bill, funds are provided for training of paramedical personnel, which will assist the doctor. The doctor will have different aides, assistant physicians, technicians, and so on to help him. This provides for training for the paramedical personnel.
That leads us to a question that's been sent in by A.L. Brownmuller of Los Angeles, California. And both of you gentlemen, perhaps you can comment on this. Mr. Carter first. I find it remarkable that with a distinct need for physicians in this country, the qualified students must go abroad to generally inferior medical schools. While the operation of new medical schools in the United States is expensive, isn't this an expense well worth including in the federal budget? Isn't it absurd for us to need doctors but not have the means of training them?
It certainly is. We're trying to provide means of training our physicians. It's not well known, but the federal government at the present time pays 50% of the cost of each medical school in our country, and as much as 70% of the cost of some. Even Harvard has approximately that much assistance. On the other hand, part of the bill, health manpower bill, which we are considering, and the part which passed the Senate, provides funds to train our students in medical schools if there are no slots available in the United States. Not only that, we're providing massive aid to schools which are in trouble, and even more extensive aid for new schools in our country to establish new ones.
Congressman Roy?
Yes, we're seeing a rapid increase in the number of slots in medical school. This has increased by about 40% over the last 6 years, and if the Health Manpower Training Act is properly funded, we will have an additional 50,000 physicians trained in this country by 1980.
Well, how does the AMA feel about this? There have been charges made that the AMA has been resisting the increase in slots and increase in the number of medical schools that are available in this country.
Well, I think both Dr. Roy and I are members of the American Medical Association, but no such feeling on the part of the American Medical Association has been conveyed to us. I don't think there's any attempt on their part to want to hold the number of doctors at a certain level. It's necessary for us to increase the number. We know that, and we hope to reach that level, an adequate number by 1982 or even sooner, under the present plans which we're attempting to carry out.
Well, I recall in the days of our late and lamented friend Mendel Rivers that he became so distraught about the fact that there were insufficient places for our students in medical schools here that he was going to set up a military medical school in order to force the medical profession to have additional medical schools.
Well, medical schools really are not controlled by the medical profession. Of course, we try to support our universities. Dr. Roy and I both, and I'm sure the other two doctors, physicians in the House do this in every way we can. We're at the present time under the present bill under conference. We have provisions requiring the medical schools to increase their enrollment and paying them for increasing their enrollment.
The other thing we're encouraging them to do is to go to a 3-year school, and I think we'll see the time when we produce physicians with just as much education as they're getting now at the end of a 6-year period. Now, this will give us a wave of about 3 1/3% more physicians than we have presently. That this is a one-time thing, of course. Well, with regard to the AMA and with regard to medical educators, I think we've been slow realizing the acuteness, perhaps, of our shortages. But I feel that the American Association of Medical Colleges and AMA right now is fully in the spirit of this thing, and I really feel that the crux of the whole matter is going to be proper funding by the Congress, because there's money in this bill for new medical schools, there's money for shortening the period of education, there's money for increasing markedly the number of open slots for medical students.
One point before we close this segment of our show, and that is the medical profession generally opposed Medicare when it first was proposed.
Yes, that's right.
How do they feel about the question of universal health insurance?
They have their plan, their Medicare plan, which is right good. Actually, they supported elder care, which may well have been, if we really consider it and go over it, as good a plan as Medicare is today. It was quite a good plan, but it came late and wasn't thoroughly understood by the people.
I think all of us who've practiced medicine feel that Medicare is something we would have been hard put to be without since 1965 because of the need for the care for the elderly. The profession, I think, again, has been somewhat slow to recognize these things, but I think there's a general feeling that national health insurance is coming, that it should be planned in such a way that it's good for all the people. And I think the other factor is that we have to differentiate between national health insurance and a national health service. I think there's still tremendous resistance to a national health service whereby the federal government got in the business of providing the services, where the physicians and other people in medical care were actually in the hire of the government.
Well, we'll continue with questions for both of you gentlemen in just a moment after a word from our local stations. Our next question, Congressman Carter, comes from Robert Johnson of Flushing, New York. He asked this question. One of the big factors in our economic problems is the productivity of workers. I've noticed that productivity suffers greatly because of work days missed because of something so simple as the common cold. What's being done to cure the common cold? Couldn't we really find a cure if government were willing to fund the research?
I think research, well, I know that research is being funded for the common cold, but the common cold is a complicated matter and may not be caused, is not caused, as we think of it, by one single virus, but by many, many different things. Vaccines have been developed for the common cold. The effectiveness has not been proven, but research is going on, and a serious attempt is being made to conquer it.
Dr. Roy, would you like to comment
I
on that?
agree with what Dr. Carter said. You know, we get into sloganeering like we can send a man to the moon, but why can't we cure the common cold? The common cold, I think, has many difficulties, and lots of medical research has many difficulties in the basic science research that we didn't have with sending a man to the moon. I do feel that we're moving ahead, and with our advances in virology, these things will be met in time, and I think there's enough dedication of effort.
Well, that brings us, again, you mentioned the key word here. James Burton, Vermillion, Ohio, asks, I find it amazing that a country which can spend billions of dollars to put a man on the moon won't spend the money to find a cure for cancer. Why isn't Congress making the same effort it made for the space program for a cancer cure?
I think what I said in my previous statement has something to do with this. Congress is now dedicated, and the administration is dedicated to putting additional monies into the cure for cancer. We've been spending about $230 million. This will be advanced by $100 million this year. This money's already been appropriated. I think this will give us all of the money we need for the quality research which is now available. Now, I think in the future we will need additional money, because the country will get geared up and we will attract additional biomedical researchers into the field of studying cancer. Again, there's some basic scientific knowledge which we don't have, and I don't think there's going to be a magic bullet or a sudden breakthrough in this area. I think it's going to be a great deal of hard work and research, but the dedication is in the Congress, the dedication is in the administration. It is not a political matter. I think we want to join arms and accelerate as rapidly as possible the research on cancer. And this is certainly a frightening and horrible disease that we all want to get to.
Dr. Carter, we've spent about $50 billion to get to the moon.
Yes, sir.
And perhaps if you added all the money together, we've spent less than $1 billion on cancer research.
Oh, I think you're wrong on that. The National
government
Cancer
funding.
Institute was established in 1937. At that time, it cost $1.8 billion, and it's been gradually going up. At one time, we actually gave the Cancer Institute more money than it could use. At the present time, it's spending at the level of approximately $237 million per year over a number of years, and will be increased, we hope. At least we're including an extra $100 million, or mean to, in the present bill. Agency for Conquest of Congress, and this year we will spend approximately $337 million. It won't be cured by money. Dedicated scientists must work in this field, and I assure you they have been working.
Dr. Carter, I think that
Yes,
the thrust is not how much money we spend, but the massive effort that has gone into the conquest of
Yes,
the
sir.
moon.
Yes, sir.
It doesn't seem to be being put into the conquest of these not simple diseases, but these very difficult diseases that we have facing us and mankind.
Well, I'm certainly for putting in what it takes if it's a matter of money. But again, well, we've had quite a massive effort. As I told you, the National Cancer Institute, of course, it has its own buildings and its own research going on out at Bethesda. Not only that, it gives grants to institutions throughout our country and to schools throughout our country, and great progress has been made. If you've read recently, leukemia in some instances has been, some cases has been arrested for periods of years. Even the acute forms. Now, instead of a patient who has this living only 30 to 60 days, lives up to 14 months. And others with a chronic form live 15 years or more. And the same thing with Hodgkin's disease and other forms of cancer.
Let me add, I certainly have no argument with the thrust of that question. I think this is going to be a decade of dedication to health care in the Congress of the United States. I think it's extremely necessary that we change our priorities from perhaps space and military spending to certain other types of spending, such as housing, education, and, as I said, perhaps above all, health care. And I think we are seeing this change in priorities, and I support it very, very strongly.
Well, on that subject, Congressman Roy, Ira Feldblum of New York sent in this question. There seems to be a national problem getting medical care to the people who need it. There are few doctors and only run-down hospitals in urban ghettos. A doctor won't even make a house call in many areas. Rural towns can't even find doctors. What I want to know is Congress doing anything about this? She concludes all the science in the world won't help if there's no one to treat the patient.
We've done several things. I would hesitate to state that they've been enough. The Emergency Health Personnel Act was passed by the Congress last year, whereby public health doctors can be assigned into areas of great need. The increase in manpower is of extreme importance, and I think we're well on our way in this regard. We've offered forgiveness of certain indebtedness that students might have contracted for during their times of education. None of these things have worked quite enough. Now, we may be looking at additional things. We may be looking at satellite HMOs as far as the HMO programs, health maintenance organizations who are actually required to have offices in certain areas, for example. We could be looking at assignment somewhere along the line of young physicians or medical school physicians or some other groups of physicians into these areas. I think our object, and I think the object that Dr. Carter and I would agree upon, is that quality health care be available to the people of the United States at a cost for which they can afford. Now, I think the most difficult part of that formula is availability, is getting health care personnel into the areas of underservice. And those are just exactly the areas that the questioner mentioned. They're the rural areas and the inner city areas. We're acutely aware of this problem. We have not wanted to go to the absolute assignment. We don't want to go to what Senator Stennis says, for example, about an all-volunteer Army. We'll get it when we draft it. We'd like to find some other ways of getting health care personnel into these areas, and we're working with it vigorously.
Well, just last year, as Dr. Roy said, we passed this bill which would permit assignment from the Public Health Service of physicians to impacted areas, ghetto areas, and rural areas throughout our country. I'm in hopes this will be helpful. Not only this, some of our universities are, and I'm happy to say that in my state that 2 medical schools have plans now in which they send students and their residents into rural areas to provide pilot programs and to go ahead with medical assistance to people in those areas.
Well, we must break
Yes,
now for
Yes, sir.
our stations to have an opportunity to have a break themselves.
They've already done it.
Congressman Roy, our next question was sent in by F. Jeans of Lake Tahoe. I can understand why doctors began to specialize, but I can't help wonder if it hasn't gone too far. It's almost impossible to find a general family doctor these days. Why? And is anything being done about it?
First of all, the why, I think it's been only about 35 years ago that we really turned to the specialties, and there was a great thrust, of course, for quality medicine, and that resulted in specialty training and specialty boards. And then the medical schools emphasized this greatly for 2 or 3 decades. And there's been a great tendency for all of our medical school teachers to be specialists, and for students to want to be like their teacher, and for the teachers to reproduce themselves. I think this has been the big why in the situation. Now, I think it has gone too far. I think there has been great emphasis again in the last year or 2 on producing more family physicians. Now, family physicians in themselves have been recognized as a specialty. We now have a board of family practice. And the thrust now is toward the primary physician or the family physician. Again, going back briefly to the Health Manpower Training Act, there is money in there for departments of family practice within medical schools and for graduate training as family physicians. There's a great awareness among our young people who are going to medical school, and I was told just yesterday that 40% of one class has chosen a tract in this particular direction. Our medical schools, as Dr. Carter indicated, are now trying to rotate their trainees through actual family practices, so they see that, and not just the rather sophisticated practice within the university hospitals. Is this the way you see it, Dr. Carter?
I certainly do. There's an increased awareness among the students of the need of the family physician. and as you stated, an increased percentage throughout our country are attracted to this particular field. And in the present Health Manpower Act, authorization for funding for departments of general practice throughout our country have been made.
Congressman Carter, T. Clement of Buffalo, New York, has asked a question that concerns us all. Why do medical costs continue to rise so rapidly? Isn't it true that the expense of hospital care and related medical expenses is rising much faster than the cost of living generally?
Well, I would have to say that I believe that's right. We're in an inflationary age. That's one of the causes of this. Another thing, which perhaps we did innocently, we raised the minimum wage, which I voted for, frankly. I thought that many of our people were underpaid, but we can trace a lot of this to when the minimum wage really started, and I regret it. Then perhaps some positions may be guilty of overcharging. I hope not too much. I'm afraid that this may be so. Costs in every field, though, have increased greatly.
I think we need some changes in our healthcare delivery system. We have a system now. I don't think it is a non-system. But I think national health insurance should be directed towards some of these changes, and I think these changes should make it easier for the patient to move through the healthcare system. I think we've seen some incentives over the past few years as more and more of our people, fortunately, have been covered by health insurance, but incentives to have our patients at the point of highest care costs, which is the acute hospital.
Well, isn't it true, too, that you have a duplication of facilities from hospital to hospital where perhaps there's not the necessary utilization of those facilities, and as a result of which, as a result of the duplication, you get a higher cost of maintenance of the hospital?
Our health planning has been, I think, inadequate in some of these areas. Now, there's been an attempt all the time, of course, for health planning. But in Topeka, Kansas, we have 2 general hospitals 400 yards apart, and they duplicate many services. I don't think we, the public, can afford to see this go on forever. I don't think the competition between hospitals is as important as what I would call the competition between good health care and not so good health care. Our competition's with quality health care.
Thank both of you gentlemen. The time has passed quite rapidly, but the time has run out on us, actually. Congressman Roy and Congressman Carter, we want to thank both of you for your appearance here on Ask Congress and for answering our questions and the discussion of a very crucial question of health care in the United States. Let me remind you of those of you who are in our viewing audience that if you have a question that you'd like answered by a member of Congress, send it on a card or a letter to Ask Congress from 471 House of Representatives, Washington, D.C. And now, until next week, Ask Congress is adjourned.